Do you have pain when you move your arm behind your back or above your shoulders? I will follow you through step-by-step guide from understanding the potential cause to a workout that you can do in less than 2 minutes. The first step in rehabilitation is trying to understand what part causes pain. Rotator cuff injury is one of the most common causes of shoulder pain. It refers to four muscles that wrap around the shoulder joint. The supraspinatus muscle does shoulder abduction. Infraspinatus and teres minor make the external rotation, and the subscapularis makes the internal rotation of the shoulder. They are also important because they provide the shoulder with much-needed stability and are often the key to painless shoulders, so remember to include them in your workout. They range from tears to acute tendinitis and chronic tendinopathies. Degenerative changes, repetitive microtraumas, and severe traumatic injuries can cause tears. The cause of tendinopathies is currently unknown, but there is an increased incidence of shoulder pain in individuals who participate in repetitive overhead activities, including repetitive throwing sports like baseball or volleyball. To find the right diagnosis, a qualified professional such as a physiotherapist or doctor will try to find the exact reason for your pain. History taking is one of many steps to diagnosis. He will be interested in your activities and potential previous shoulder injuries. He will also do a physical examination. He will check your range of motion and muscle strength, and they might do some special tests. The third way is medical imaging. The gold standard to evaluate rotator cuff pathologies is MRI. It can detect tears and inflammation and may help to determine size and character to establish a proper treatment. When the cause of pain has been found, there is time for treatment. The best thing you can do is continue the process with a professional to help find the right treatment for you. However, you can do many things at home as well. The use of non-steroidal anti-inflammatory drugs like ibuprofen and aspirin may have a pain-reducing effect, but before you take them, talk to your doctor. Initially, rest and ice are used to decrease pain. It's vital that patients initially avoid activities that increase pain and unpleasant symptoms. Later on, when the pain gets lower, you can do many exercises that increase the range of motion and bring shoulders. For shoulder mobility exercises, you can use a stick such as a broom or a walking stick to assist your injured arm. Try to do all of the exercises in full motion until you feel pain. First, I will show you 3 mobility exercises. In the first exercise, you raise your arms from front of you to all the way above your head. After you reach your pain point, you slowly move your arm down and repeat. In the second exercise, put your arm along your body and then flex your elbows to 90 degrees. Your goal is to move the stick from the left to the right side of the body in a horizontal line parallel to the floor. At the same time, try to keep your elbows beside your body. For your third exercise, you put your stick behind you. Your starting point is somewhere on the hamstrings. Your goal is to slide the stick up along the spine until you reach your pain point. When you do, you slowly move the stick back down and repeat. All of the mobility exercises can be repeated about 10 times. For stability exercises, there is no better than the so-called the lock 3. You start your workout laying on your belly with your hands along your body. In the first exercise, you turn your palms upwards or away from the floor. You try to lift your arms off the floor and then gently and slowly move them back down. The second one is the same, just that you put your palm towards the floor. The third one, you put your arms in line with your shoulder in T shape. You also put your palms towards the floor and lift them off, and then gently put them down. You do all of them 10 to 20 times. I highly recommend using low weights, but if you don't have them, you can always fill half a liter bottle with water. These exercises are amazing for shoulder stability. They are also the best for warm-up for bench press and overhead press exercises. Shoulder pain makes your daily living hard, and I hope that, with a bit more understanding in these tips, you will have a pain-free life. In the comments down below, you can tell me what new have you learned today. Now have a great day, and don't forget that the difference between try and triumph is just a little oomph.